Hi, my name is Yoda, and I'm the pharmacy intern that's covering the general medicine floor at Northeastern University Hospital. I'm following up on a question I was asked from an intern regarding patient JJ. The intern informed me that JJ has been on alendronate for 10 years and was inquiring about the issues with long-term bisphosphonates and what should be done. JJ is a 66-year-old Caucasian female with a past medical history significant for hypertension, high cholesterol, obesity, seizures, a DVT in 2013, a Roux-en-Y gastric bypass in 2015, and osteoporosis. JJ takes alendronate 70 milligrams by mouth every Monday for osteoporosis. Bisphosphonates like alendronate, abandronate, and solendronate are used when bones become brittle and fragile as a result of aging, hormone changes, or a deficiency in calcium and/or vitamin D. Osteoblasts are cells in the bones that help with formation, and conversely, osteoclasts work to absorb bone tissue. Bisphosphonates are helpful in osteoporosis because they work to inhibit osteoclast activity. While bisphosphonates are relatively well tolerated, GI symptoms are very common. Patients may complain of esophagitis, esophageal irritation, heartburn, abdominal pain, and diarrhea. For this reason, it's recommended that they are taken with a glass full of filtered water and remain upright for at least 30 minutes after taking their dose. And since food can decrease the absorption of oral bisphosphonates, it's important for patients to take it on an empty stomach as well. Long-term use of bisphosphonates has been associated with an increased risk of osteonecrosis of the jaw and atypical femoral fracture. Per the 2016 American Association of Clinical Endocrinologists and American College of Endocrinology, or the AACE/ACE guidelines, osteonecrosis of the jaw, or ONJ, is defined as the presence of exposed bone in the maxillofacial region that did not heal within 8 weeks after identification by a healthcare professional. It was first reported in patients with advanced cancer receiving high-dose bisphosphonate therapy. The occurrence of ONJ is lower with oral or IV bisphosphonates for osteoporosis, and treatment could be stopped if the patient was undergoing an invasive dental procedure. Good oral hygiene and regular dental care can help decrease the risk of this adverse event. Atypical femoral fracture, or AFF, is another rare but serious side effect of long-term bisphosphonate therapy that's defined as over 5 years. Again, the side effect was rare and seen with higher doses in advanced cancer. Patients will usually complain of prodromal pain in their groin or thigh area. Per the AACE/ACE guidelines, it's a fracture that's located along the femoral diaphysis from just distal to the lesser trochanter to just proximal to the supracondylar flare. The patient must meet 4 of 5 criteria to be classified as an AFF. If a patient is complaining of pain in this area, the bisphosphonate should be stopped and imaging studies should be conducted, and if the AFF is confirmed, permanently discontinue the bisphosphonate, and supplementation with vitamin D and calcium should be considered. Teriparatide is a medication that can help heal an AFF and can be used with or without surgery. The pathophysiology for why an AFF occurs is not completely understood. One proposed theory is that bisphosphonates prevent the toughening of cortical bone, which is an important protection to a clinical fracture. Bisphosphonates can accumulate in the bone and have effects even after the drug has stopped. For this reason, bisphosphonate holidays have been proposed for certain patients. The optimal duration of a bisphosphonate holiday is not established and will vary based on the patient. The purpose of the fracture intervention trial, long-term extension, or the FLEX study, was to examine the long-term safety and efficacy of oral alendronate in postmenopausal women that had also received alendronate in the primary FIT, or the fracture intervention trial. It was determined that higher-risk women classified as a T-score of less than or equal to negative 2.5 that stopped treatment had nearly twice as many non-vertebral fractures, which suggested that longer treatment durations are appropriate for higher-risk patients. For lower-risk patients, a bisphosphonate holiday can be considered after 5 years on oral bisphosphonates or 3 years on IV zoledronic acid. For higher-risk patients on a bisphosphonate holiday, teriparatide or a weaker anti-resorptive drug such as raloxifene might be appropriate. As of right now, the risk-benefit ratio for treatment beyond 10 years remains unknown. In patient JJ, I'd recommend discontinuing her alendronate as gastric bypass is an explicit contraindication for oral bisphosphonates due to potential GI malabsorption. Since gastric bypass can actually contribute to the risk of osteoporosis and fractures, it's important to provide vitamin supplementation, and non-pharmacological measures to protect bone health. The AACE/ACE guidelines recommend women 50 years and older get 1,200 milligrams per day of calcium and at least 1,000 units of vitamin d per day. I'd recommend Citracal 1 tablet twice daily, as it would allow patients to meet their recommended daily intake. In addition, the patient should consume a balanced diet, regularly perform weight-bearing and balance exercises, continue to avoid tobacco use, limit alcohol to 1 drink a day, and take measures to avoid falls. In addition to other parameters that are monitored post-gastric bypass, the patient's calcium and 25-OHD blood levels should be evaluated at least yearly, with a goal of 8.4 to 10.4 mg per deciliter for calcium and 25-OHD blood level of approximately 30 nanograms per milliliter. So just to summarize, AFF and ONG are rare side effects that have been associated with long-term bisphosphonate therapy. The treatment of bisphosphonates beyond 10 years is not known at this time. Since the patient had a root and Y gastric bypass, bisphosphonate therapy is contraindicated. The patient should be started on Citracal 1 tablet twice daily instead to supplement calcium and vitamin D, and non-pharm measures like exercise, diet, and precautions against falls should be taken. If you have any questions, please feel free to follow up at 617-373-1234 or page me at beeper4567. Thank you.